everyone. My name is Sai. Thank you so much for being here this evening. I'm thrilled to be hosting Dr. Anderson for our PhysiLink webinar today. I'm super excited to welcome Dr. Kate Anderson to today's webinar. Thank you so much for taking the time to speak with us today.
Thank
Dr.
you for having
Anderson,
me.
oh, of course. Dr. Anderson became a mother at 15 years old, an experience that shaped her resilience and determination to pursue a career in medicine. She earned her undergraduate degree in nutrition from Arizona State University before attending medical school at the University of Arizona in Tucson. Now a second-year general surgery resident at St. Joseph Medical Center in Tacoma, she is passionate about patient care and advancing her surgical training. Outside the hospital, she enjoys hiking, crocheting, knitting, and exploring the beauty of the Pacific Northwest with her family. Dr. Anderson, thank you for joining us. We're excited to hear from you. Is there anything else you'd like to add to your introduction and share about yourself?
No, that's me in a nutshell. Thank you for hosting me.
Okay, let's go ahead and get started. So, I was really intrigued by your journey to where you are now. I was wondering if you could walk us through your path to residency and how becoming a mother at the age of 15 played a role in that.
Oh, yeah, absolutely. So, uh, boy, yeah, when you come to be a parent at such a young age, you really kind of you give yourself the short end of the stick, in terms of like how society sees you. You become instantly a statistic, and I felt a lot of pressure to make something positive out of what a lot of people see as a negative. And, a lot of people see that as the end of somebody's life. And so I was determined to finish high school. My mother was very, very generous and looked after my baby during the days until I graduated. And then when I moved out, my now husband, the baby's father, worked nights and I worked days. So there was always somebody there with our kiddo while we worked. And I went to school remotely first. Um, Several years down the line, I was working, front office medical jobs, and started working in a big hospital, and got exposure to medical education and residents for the first time. And I thought, like, wow, these guys are, really working their tails off. And I keep topping out at these desk jobs that I get to and getting bored and looking for the next thing. I bet they've never been bored in their lives. So that was kind of my exposure to medical education, and inspired me to pursue it for myself, going somewhere where I could learn for the rest of my life and have some job security and always be engaged.
Yeah, absolutely. That's really cool. And that's definitely a story that not many people can talk about, and definitely something that is very, very impactful, as I can tell. So, moving on to the next question. What drew you to general surgery and what kind of cases do you commonly see?
Oh yeah. Um, wow, general surgery is a lot of excitement, and keeping in the theme of, wanting to always be a learner and engaged, there is so much to know about surgery. I don't think I'll ever top out in my knowledge here. So that's one thing that attracted me. Um, yeah, and it's just an opportunity to, make a difference right now rather than, trying something on and seeing if it works and in 6 weeks changing it. You have an opportunity to change somebody's experience in the moment. Um, yeah, boy, at St. Joe's here, we see a lot of different cases. Right now, I'm on a breast rotation, so I'm doing a lot of lumpectomies and mastectomies and sentinel lymph node biopsies in the axilla. Recently, I was on acute care surgery where we did a lot of small bowel resections, and we did some colectomies, repaired a couple of perforated stomach ulcers. So, yeah.
Yeah, that's really cool. I'm honestly actually really interested in surgery as well. So getting to know a little bit about the different surgical like specialties is something that I've been trying to actively do as I go through undergrad. But I haven't really heard too much about general surgery, which is also why I really wanted to do this webinar and ask you certain questions that I had specifically about general surgery. So um, this one kind of is very similar to the previous question, but I know you talked about a few of the cases that you see in your second year of residency. I was wondering if you could talk about the structure of your general surgery residency and like how each year is different from the last.
Yeah, absolutely. So, what I think is really special about our residency is we have a mentorship model. So, we are a very, very small group of residents. We take two residents a year. So, in total, there are 10 of us. And there's a lot of variety in the hospital, a lot of services. And with so few residents, that means that there's not a whole bunch of overlap. You're not fighting for cases. When you do go in a case, it's typically you and the attending, and so you're learning from them one on one. In the first couple of months of internship at our residency, we go on service with a senior so that we can, learn the day-to-day goings on and, how the EMR works, where to find, supplies, etc. But after the first couple of months, you're really just one-on-one with the attending. Um, in our first year, we do colorectal, surgical oncology, general surgery, acute care surgery, trauma. We have a pretty wide exposure. Then in the second year, we do most of that again, minus colorectal, and adding bariatric surgery and also a transplant rotation that we go off campus to. Our residency is based in Tacoma, and we go to Seattle for our transplant residency. In the third year, you spend 3 months doing vascular surgery and 3 months doing pediatric surgery. Pediatrics is at the Children's Hospital down the street, and then hmm, do you do ENT? I think you do ENT that year also. So, um, it's a lot of new experiences, but also coming back to the rotations that you had done the previous year and getting to do it again, having, a new perspective.
Yeah, no, that's really cool. And I was always curious about this, and I was reading about plastic surgery the other day, and you talked about how you kind of have different experiences with different types of surgery and different specialties. So, say once you finish your general surgery residency, do you see yourself going on to do a specialized surgery or staying within general surgery? And how would that general surgery attending position look like?
Yeah. Oh man, the world is wide. So if I had to choose today, I would go be an acute care surgeon somewhere and take care of all of the perforated appendicitis and nasty gallbladders and small bowel obstructions. Um, I do have an interest in colorectal surgery, and that's on the table. That would be that's something for me to think about. And I think it would be a really rewarding career. We get a lot of exposure to colorectal, and our program director is a colorectal surgeon herself, and she is tops. um, yeah, but an attending career, I think, as staying in general surgery, being maybe an acute care surgeon, could look like um, having, balance between an outpatient practice where you are doing consults and seeing patients, in the clinic, scheduling them for surgery, be it like a hiatal hernia or some general surgeons will do colectomies, gallbladder surgery, um, and then, having night call, weekend call, or, a week or 2 weeks even of call in the hospital. So then instead of being, seeing patients in the clinic and, having 3 days operating per week, you would just be in the hospital, taking the inpatient consults and managing the floor patients. So maybe some balance like that.
Absolutely, that's really cool. I was wondering if you could share what a typical day looks like on a regular basis, or if you could talk about a specific day in mind where you were up at like say 4 a.m. and you didn't stop and you were doing a 24-hour shift, or what does that look like for you?
Yeah. Oh boy. Um, So several months ago, it was the middle of my intern year. I was on colorectal service, and it was an operative day. So you're in early, waking up at 5:30 or so, and getting to the hospital at 6, seeing your inpatients, writing. Doing all the updated orders, writing your progress notes, and then being at the operating room at 7 o'clock, seeing your first patient of the day, getting them in onto the table, positioned and ready to operate. We did a few cases that day, and then before we left the operating room, for the last patient that we were operating on, around 5 o'clock, we had somebody come. So we went to do our consult after that operation ended, and this was somebody who needed an emergency surgery. So we went back to the operating room a couple of hours later, um, and then we had another one. And by that time it was, very, very early in the morning. But at the time we had finished the second emergency operation. And so rather than going home, I just stayed the night in our call room and got up early in the morning and did it again. So despite not being on a 24-hour shift, that day turned into a very long day.
And I was super curious. I know with residents sometimes working really long shifts or back-to-back surgeries, how how do you guys stay awake and how do you stay hyper focused, like especially when surgery is so delicate and so small and minute and tedious? How do you stay in the zone and not let the sleep deprivation get to you?
Yeah, that's definitely a struggle. I am a big fan of like micro naps and pre-caffeinating your micro nap. So if you are sleepy enough to be able to fall asleep and you need to continue your day or your night, drinking an espresso or a cup of coffee or having a Celsius, laying down and sleeping for, 15 minutes to half an hour and then waking up, and by that time your caffeine should have kicked in, and then you can keep going. Um, it's certainly not the healthiest thing that you can do, especially, being a physician and you're telling people, sleep is important and nutrition is important. And here we are doing the opposite. But when duty calls, you've got to make sure that you're ready to go.
Yeah. Well, thank you so much for sharing. It's something that I've always been wondering about, especially with considering surgery potentially in my future. Hopefully, that's a avenue that I can take. And I was wondering if you had a specific case that impacted you a lot and really confirmed, especially during residency, whether that general surgery was the place for you.
Boy, let me think. I don't really have a particular case that was it for me. I think that in every case that I've had, there is something to learn. There's a patient interaction that is highly affirming to me. Um, Learning about people's experiences, who they are outside of the hospital, and recognizing that you have the privilege to take care of them in this moment and, do something that gets them back to living and being who they were, outside of the hospital is an incredible experience.
Thank you for sharing. So we actually do have a question in the chat. Were there any specific experiences or cases that really stuck out to you in medical school that drew you towards general surgery residency?
Um, Particular cases, man. I have to say I just had a great time in medical school. I did a month worth of trauma nights, and that was exhilarating and exhausting. And you got to see some really neat pathology coming in through the trauma bay. Um, hmm. One in particular that pushed me towards surgery. Boy, I wish that I had some kind of very exciting story, but just I think my entire surgery experience in medical school was that experience for me.
Yeah, and kind of I hear a lot from some medical students who rotate through surgery who don't have the best experience within it, and it kind of closes them off from it. Why do you think that is, and why do you think your experience with surgery was very valuable and so much different from that ideology?
Yeah. Um, I think that people can become very focused on what they're doing or what is on their mind at that moment and can lose sight that they're an example to the people around them, that their communication matters to the people around them. And I think I have seen a lot of poor communication, a lot of like anger expressed unduly to medical students in every rotation that I have been on as a medical student. Surgery, I think, can be a particular source of those kinds of behaviors because of the, the nature of the job. It's high pressure. And it shouldn't be. It should be high pressure. That's just the way that it is. You're looking after people, people's lives are in your hands, but it shouldn't be that people feel like surgeons are a big, group of jerks. In my experience, not every surgeon is a big jerk, but we do have our fair share. I also found some in pediatrics, a couple in psychiatry, even the fields that are well known for being kind and welcoming have their fair share of people who don't really fit that mold. Um, and I would say to those that find themselves drawn to a particular field, but pushed away by the personalities that they find there, to really try hard to um, decide whether you can live without being that physician, that surgeon, that psychiatrist, um, for the rest of your life. Don't let the bad ones turn you off. Look for the good examples and really listen to your heart, and follow it into what you want to do.
Absolutely. That makes a lot of sense, and I think that helps a lot of people understand that one bad experience shouldn't shape what you want to do in life. It should be something, as long as you're still passionate about it, you should definitely stay on that track. And this question is a little bit about your undergrad experience. I was wondering if you could talk about, because a lot of viewers who view this recording when it'll be on YouTube are undergraduates. And so I was wondering if you could talk about your experience with having a child in undergrad, with going through the rigor of being in undergrad with all the extracurriculars, MCAT, and all that, and how that led you to pick your specific medical school. Because obviously each medical school is very dependent, like whether on the person and if it fits what they are looking for in their training.
Yeah, definitely. Um, yeah, by the time that I was doing my undergrad, I had two kids. So, one came 4 years after the other. So, they're 4 years apart. Um, and I have the absolute pleasure of being married to probably the best man on earth, who really worked his tail off to support me, and to support all of us, continuing with night jobs, and then transitioning to day jobs, working while he went to nursing assistant school and eventually, when I was in med school, went to nursing school himself. So for me, it was like waking up, getting myself ready, going to work, and either going to school directly after work or coming home, putting something in the crock pot, heading down to school, and coming back late at night, doing homework in the middle of the night, and then waking up to do it all again. I did a bachelor's degree in nutrition with Arizona State University, and that was a distance learning program, which was great. I was able to do that from in my home. But then I also, at the same time, was doing my prerequisites for medical school at the various community colleges in the Phoenix metro area. So, one day I might be driving 30 minutes to Mesa, the next day I might be driving 25 minutes to Glendale, that kind of thing. Um, but yeah, I had a lot of excellent family support. And by that time, my kids were, we had one that was in, let's see, kindergarten, and the other, 4 years ahead of her. So they weren't too terribly dependent on mom. Um, yeah, and in terms of choosing a medical school, when I walked onto the campus at U of A in Tucson, it was first off, it's gorgeous, beautiful, like glass and concrete buildings. Very, very welcoming people. Everybody that I met was very kind. There were a lot of students who had families, and who felt well supported by the university. And that really made for an excellent first impression. And yeah, by the time I got done with my interview that day, I was like, well, I know where I need to be.
Absolutely. And I've heard a lot from undergrads who come from USC or other schools, and they talk about how like when they could go either tour the school or right after interview, they're like, that's the school for me. And that's a feeling that I hope that I can have whenever I do apply and eventually hopefully get interviews. Obviously I don't have that understanding of it yet, but it really seems like a really cool experience to tour or to interview at a school and just know it's for you. Um, but next question. So with undergrad, medical school, and now residency, obviously it's a roller coaster of emotions, a roller coaster of obstacles. What would you say the toughest year was for you within that time frame?
Yeah. Oh boy. Am I allowed to have two tough years?
Absolutely.
I think the transition between like undergrad or post-bac and medical school was very difficult for me. And then the transition between, being a fourth year medical student and being an intern was also very difficult. Um, in terms of, first year of medical school, it's just learning how to manage all of this wild coursework, and the exams that come, one right after the other very quickly, um, and kind of navigating a new social landscape. Like, wow, you're in this privileged position of being a medical student, and it's incredible, but also like, do I need to be, like, who am I now? Do I need to be stuffy and, very straight-laced, or can I still keep my personality and my sense of humor? Can I relate with patients the way that I related, with people that I worked with and for in the past? So the kind of identity finding, in addition to adjusting to all of the coursework and the new life in a new city. And then adjusting to internship. You're learning a brand new EMR, you're in a hospital that I had never, been to outside of my interview day. Um, you've got to learn the landscape of the hospital. You've got to know how to put in your orders. How does my attending like anything? How do I operate? Um, how do I send a message to somebody I need to get it to? And then, wow, I still have to make sure that I know my way home from here. And where is my grocery store going to be? Did I change my voter registration? All kinds of new experiences in a new city and in a brand new role. Plus, you're used to having protected time as a student, for studying, et cetera, and you're used to having a very structured curriculum. This is what you're learning this week, and this is what you're learning next week. In residency, you do, as a general surgery resident, you have the SCORE curriculum, and you do have conference every week where we talk about, or where we, learn about whatever that topic was. But I think that's a very narrow slice of what a general surgery resident should know. And so the rest of the stuff doesn't necessarily have that structured curriculum. You're in the textbook yourself and trying to find out for yourself what is the salient point and trying to apply it to what you're seeing in the operating room.
Definitely. So with all of the with the, all the things, all the new things going on, especially with transitioning and with mental health becoming so important nowadays, how do you keep yourself from burning out? Especially when transitioning and learning so many new things, going from your senior and undergrad to your M1 year and then M4 all the way to intern year. So
Yeah. In medical school, I think it was a lot easier. In medical school, I had a wonderful network of, close friends, and we were in proximity to each other, obviously in the same city, going to the same medical school. Tucson is a beautiful city that has excellent hikes. Sure, it gets a little hot, but you can work around it. I was outdoors more frequently, exercising more frequently, cooking more nutritious meals more often, and had I think, a better social experience in medical school than I have had in residency. And so burnout was not as big an issue for me in medical school. In residency, I think it's tougher to balance the responsibilities that you have in the time that you're given. There's only 24 hours a day. There's a lot to do in those 24 hours. I do have a much smaller social network now, but my medical school friends are just a text away, and we're all, experiencing similar things, so we can all commiserate. Um, I have a wonderful time sending them little gifts through the mail. It brings me all kinds of joy and, helps stave off, I think, the burnout. I am, very close with my family, so call and text frequently, take my dogs for a walk as I can, and just try to listen to my body as well as my brain. Um, Sometimes it can be very, very difficult to focus on, studying after I get home from work. And that's a cue for me, like, actually, this is not going to be very productive. Your brain needs a break. Why don't you pick up one of your knitting projects and do that for 30 minutes before you try to hit a book? So,
Yeah, so I just started working in the hospital as a CNA in the interventional radiology department. And so I was studying for the MCAT a few months ago and starting work, and especially on the days that I work and coming back home like around 5 or 6 and then trying to study, it was definitely tough. And honestly, I still don't think I figured out the best way to go about that. And I know with M3 year, that's huge, especially with going through clinical rotations and then coming back and studying for your shelf exams and then eventually step two. What do you think a general takeaway that people should have? I know you focused on knitting and also we talked earlier about crocheting in your intro. How do you think someone should approach that, especially like in undergrad and whenever it comes up in medical school?
yeah, try to set yourself a schedule, like for like number of minutes or a length of time that you'll be studying daily. Um, Try to schedule the topics that you're going to be studying and also build in breaks. Like a break between getting home from work and beginning to study is so, so important for you to shift gears, get out of the headspace of everything that happened during the day, get a little bit of relaxing time in, eat your dinner, go for your walk, do what it is that's important to you, and then shifting into student time. Um, and then in terms of like the day to day, I think it's also important to build in break days. So when I was studying for step one, I had like a really well laid out plans, like by the hour, by the topic, um, and I stuck to that. And part of the reason I was able to stick to it was because I had breaks built in. Like on Saturday, I am studying absolutely nothing. It's required of me that I do not crack a book. And then I could start the week again on Sunday and be ready to go. And then I had something to look forward to on, Wednesday when I was sad with my life because I knew Saturday was coming up again and I could do whatever I wanted to. So yeah, breaks are not optional.
Yeah, I think especially nowadays, I think a lot of us just want to keep powering through. And sometimes we see breaks as not productive just because we're not doing anything, but it honestly adds so much. Like I even felt it when I would take certain like hours off or certain days off, like go to the gym or go do something fun or go play basketball, something that honestly just brings me joy, help me like recenter myself and make myself remember why I'm even on this path and why I want to become a doctor. So, thank you so much for sharing that. Uh,
Yeah,
the
absolutely.
next question is, so with your transition from intern year to second year, what got harder? What got easier? Could you talk a little bit about that?
Yeah. Well, by the time I started second year, I knew where all of our other clinical sites were. I had a good idea of, the layouts of all of the hospitals, know how to do my orders. The day to day got easier. The expectations change as a second year, because, you're really just finding your way as an intern, and you have um, a higher expectation for more in-depth and wider clinical knowledge, I think, is a second year, and that's been a challenge. It's a good challenge, but still challenging.
Definitely. Is there anything else you would like to say to the undergrads or even med students who eventually watch this recording on YouTube? Any advice or anything like that?
Oh, yeah, absolutely. Take advantage of your school's mental health resources. Um, And do it early because you don't want to find yourself in the middle of a crisis and have to be like waiting 3 weeks to talk about it. So establish early and meet as often as you need to. Um, Try to in terms of like school choice, specialty choice, even like profession choice, like listen to your heart, listen to what your body is telling you. If you are like sick to your stomach every time, like a bad sick to your stomach every time you go to a certain place, like maybe that place ain't it. If you are like tachycardic and it feels kind of good every time you step into the operating room, like maybe that's the place for you. Um, on your rotations try to separate out, am I having an excellent time because the people that I work with are making this really fun and it's really cool, or do I really love the work? Or is it both? And let that kind of guide you in terms of specialty choice. Um, don't let the bastards get you down because there are some of them everywhere. Remember who you are and bring that person with you wherever you go. Uh, and just do it. Like if you have interest, find out.
Absolutely. Thank you so much for sharing that. We actually do have one other question in the chat that says, given that surgery is a relatively long and demanding path, how do you maintain your motivation and focus on the long-term goal?
Oh yeah. So I told myself from the outset, like this is a super long path, but I'm gonna age anyway. So I can either age and be a surgeon at the end of it, or I can age and be something else at the end of it. So why not just go for it? Um, I actually thought so at the outset, I thought, wow, 5 years of residency is kind of crazy. Now that I'm in like the middle of my second year, I'm like, oh, wow, 3.5 more years to learn everything that I need to know. Not enough time. Like, let me add a couple more years, man. Um, so I don't have too terrible a time with keeping motivation for the long term.
All right, I guess I have one more question actually.
Yeah.
I've considered surgery and I guess like what are some qualities, whether it's like dexterity, like physical qualities, or like mental qualities that are typically like present in a typical surgeon and or like surgical resident?
Oh yeah. Yeah. So, um, yeah, they're pretty dexterous. Surgeons are pretty dexterous. We gotta be able to maintain control of, your hands and your instruments and the tissue in pretty tight spaces. Um, Hand-eye coordination is important. And people might be born with that, but I think more people work toward that. So, having a growth mindset or developing a growth mindset is really important because it can be very easy to get bogged down in feeling like, wow, I'm really bad at this, or I'm never going to be smart enough. But that's not necessarily true, right? We just have to put one foot in front of the other, come back, every day with renewed um, hope, desire, ready to learn something. Um, yeah, just I guess stick to itiveness is what I would say.
So you think like even if you're not born with that skill, like you have plenty of time during residency to kind of develop dexterity and maybe like mental fortitude to do surgery?
Oh, absolutely. Absolutely. And even in med school, you're working at it, developing it. When you start your general surgery rotation, they're going to sit you down and teach you how to tie knots. And they're going to like teach you the anatomy of things and show you some procedures and then, send you on your way and you get to go practice those skills.
Got it. That makes sense. Thank you.
Nobody's born a surgeon. So
Yeah, so I had one more question. Um,
yeah.
with the different surgical specialties, what have you noticed um, on a characteristic level or say, I guess dexterity level, the difference between say general surgery, cardiothoracic surgery, orthopedic surgery, et cetera, et cetera?
Oh yeah. Um I think there are, the stereotypes maybe I don't know if they're there for a reason or if it's more like entertainment value, but when you watch Dr. Glockenflecken and he's like talking about the ortho bros and they're all like buff and yeah, anyway. Um I have not done my vascular rotation, but from what I know, what I hear about it is they use extremely fine and delicate suture. They use their loops, so you've got your superhuman eye magnification in, and they are incredibly dexterous in terms of like tissue handling. Um, very, gentle enough not to damage the tissue and strong enough to make sure that your ties hold. Um, yeah, I don't know if there are any particular like personality characteristics that are found in one specialty over another. Um, I think there's a good mix from what I've seen. Yeah.
Yeah, the ortho bro stereotype is very funny. As someone who actually, I really do like orthopedic surgery. I've gotten to shadow it and been in the OR. I wouldn't say I would be the ortho bro cliche, but I often get that comment about my passion for orthopedics and stuff. But what can you do? But
What can you do? You just laugh with them.
absolutely. Thank you so much. And thank you so much for being here with us today and taking the time to share your experiences and everything you learned. I know we had this webinar scheduled a few weeks ago and then you got
Oh
called into
yeah.
a case, but I really do appreciate you cooperating with us and rescheduling just so that we can get your message out to undergraduates hopefully across the nation one day. But
Oh,
um, if anyone has any additional questions or anything like that, please feel free to ask. A recording of this webinar will be available on our YouTube channel. You can also watch it as a podcast episode very soon. And as always, feel free to reach out to me or the contacts listed on the website. On that note, thank you for attending, and we hope you have a wonderful rest of your evening.